welcome to the At Peace Parents podcast. I'm Casey, and I'm here to empower you in your decision-making as a parent of a demand-avoidant child. My goal is to share insights that will generate aha moments and support your connection with your child. I'm a mom of two amazing little boys, one of whom is PDA, and I've worked with hundreds of parents just like you to teach them how to lead their child out of burnout and find the clarity, peace, and sense of community they need. Hello, everyone. I am with Dr. Alex Klein, clinical psychologist and family therapist, who is an expert in supporting families and clients who have PDA children and teens, pathologically demand avoidant, or we can say pervasive drive for autonomy. And this is our fourth podcast episode together, which is always so fun because Alex has clinical expertise and I'm coming at it from a coach and lived experience as a parent. So welcome again, Dr. Alex Klein.
Thank you so much, Casey, for having me. And I love reading all these questions from parents that they're submitting, and I love talking with you. So thanks for having me again.
Yeah, it's always such a good time. So we got a bunch of questions submitted to us from parents in the At Peace Parents community, and we selected 3 to talk about for this episode. So I'm going to kick it off by asking a question that I'm excited to hear the answer to because I don't have clinical training in this, but this was submitted on Instagram. So the question is, what is the relationship between PDA and DMDD? Parentheses, I have added IED and ODD. So DMDD stands for, can you tell us?
Disruptive mood dysregulation disorder.
Yes. And then we have oppositional defiant disorder and
intermittent explosive disorder is the IED one, I believe.
Yeah. So all 3 of those acronyms, DMDD, IED, ODD, exist in the Diagnostic Statistical Manual 5. However, PDA does not. So can you help us and our audience understand what's the difference? Is there overlap? Are all 3 of these or 4 of these things the same thing? What's your perspective?
Yeah, great question. This is a big one. So let me see if I can be concise here. So, I think for things like intermittent explosive disorder, DMDD, I frequently come in contact with kids who have had these labels prior to getting an autism spectrum diagnosis or prior to, families maybe realizing that the PDA profile really applies to their kids, right? So I think that, this question makes sense in that context, that a lot of kids who, again, we ultimately see as PDD have maybe, received one of these labels. And, these labels like DMDD, for example, is really defined as, a state of sort of chronic irritability and, explosive outbursts, occurring. The DSM-5 will have more specific criteria, but it's like occurring a certain amount of times per month. Similar something like intermittent explosive disorder, similar thing, right? Sort of difficulty controlling aggressive impulses, right? Like verbal outbursts. And there's sort of, the sort of just the description of, all these behaviors. And one of the sort of reasons why I don't love these labels, right? Like, is that they are just that. They are descriptions of behaviors, but they say nothing about sort of why problems are occurring. And yeah, maybe technically you can look at the DSM criteria and sort of say, okay, I can see how my kid might meet some of those, or might actually meet this criteria because, it fits the pattern of behavior we're seeing. But, the reason I try to sort of stay away from focusing on these kind of diagnoses is, again, because it really doesn't get at root cause. I know you talk a lot about that, AC, and, generally the why of why are behaviors occurring. I think that, the ODD especially is one of these labels that, as far as I'm concerned, like I wish you could just sort of throw it out of the DSM, right? Because I think that, just throw that diagnosis in the trash altogether as far as I'm concerned, because I feel like when we see that label, I mean, it's quite pathologizing. And I think that in the minds of many people who might sort of hear that if somebody has this label, it can feel very sort of pathologized. It can also feel like, oh, this is a kid who's intentionally oppositional, right? And we know that, kids do well when they can, the sort of Ross Green quote that, and again, we're missing something really important about, well, like, why is the kid feel that need to be oppositional? What kind of, regulatory challenges associated with impulse control, associated with sensory reactivity, associated with, having that overactive stress response to when we don't have a feeling of control and autonomy, right? So like lots of things might lead to the explosiveness, but, again, these labels sort of don't really get at something really important, which is the underlying reasons about why this is happening in the first place. So, certainly there's a lot of overlap, right? The relationship between them in the sense that in a PDA, we certainly might see, of course, a lot of parents listening are going to say, yeah, I can see, this explosive behavior, this chronic irritability. Not all, right? Some kids with more sort of internalized presentations, it's going to look different for sure. But, there's a relationship in the sense that like the DMDD or IED might sort of describe this surface level behavior, and we know that, but PDAers like certainly can get triggered by all kinds of stuff. So, I think the relationship is such that like I see the diagnoses happening a lot, like again, where the DMD, IED diagnoses were there and kind of make sense in a surface level. But I tend to really like de-emphasize them in conversations with families where we're way more focused on what are the situations where that explosiveness or dysregulation happens and how can we go upstream, try to prevent it from happening in the first place by understanding a little bit more and by taking that preventative approach. So I think that's my best stab at a answer to what the relationship between PDA and these diagnoses are. I'm sure there's more to it there.
So correct me if I'm wrong, but what I'm hearing you say is you think DMDD, IED, and ODD perhaps are just capturing surface level behavior that can be ascribed to many different root causes, often related to, like for a PDA, or it might be related to neuroception around is there autonomy and equality, but also it could be a child with autism spectrum disorder or an autistic child who has sensory integration challenges or, self-regulation challenges, etc. So they're not explanatory.
Right. And I've never seen a kid who has a label of DMDD or comes to me with one of these ODD, IED labels where there has not been either, sort of the neurobiological underpinnings, right? Like the autism spectrum PDA stuff and or trauma. So, again, like those are things I want to think about. Those are things I want to talk about. And I definitely want to prevent the big escalations. I definitely want, everybody to be more regulated for sure. But yeah, I think you captured it there.
Okay, so this is kind of a meta level question, but you're going to know
Sure.
than I do related to this topic, which is like, how would DMDD, IED, and ODD made their way into the DSM-5 when there's so much resistance to something like PDA? Like, why is it that we're okay with these three different labels that aren't even explanatory in terms of what's actually going on, and yet there's such resistance to something like PDA, which actually does explain it?
Yeah. Good question. I think it's sort of easier from a diagnostic. I mean, the DSM has all these limitations, and we could spend a whole, a whole podcast talking about the limitations of the DSM-5. I think with diagnosis, we are, looking at patterns of behavior and how to capture that. Yeah. So to me, I think has to do with how easy it is, whereas a PDA, again, can be a more sort of internal experience, gets more of that root cause. And, I think that PDA also sort of like in the history of like diagnosis, like PDA is pretty new, right? Like there's not, since the 80s, 90s, and then it's really only in recent years that it's, become much more known and popular, like the last few years. And so, some of this is also kind of relates to a lack of research and needing more research. And I know that, Casey, you've been involved in some of that at the University of Michigan, which is awesome. But, I think we also need more research into PDA to sort of better define it as a construct. And that'll help to, I think, maybe add it to the DSM at some point.
Yeah.
Yeah. What are your thoughts on that?
I mean, I agree with you. I think it's like, as someone who's been trained in social science, like you have to be able to measure something. And
Hmm.
it's really hard to measure the internal experience of someone unless we're taking brain scans and cortisol samples and doing like rigorous research on what the threat response is doing. But even then, we can't measure someone's perception. Like, why are
Right.
the stress response? And with PDA,
Right.
even with sensory processing disorder, it's like once I learned that lens, it was like, oh, I can see how the fluorescent light triggers the child, or I can
Sure.
understand the scratchy shirt. But with PDA, it was like even more internal of like,
Mm-hmm.
oh, like my son is perceiving that I'm above him because of the way I'm standing and the way I ask the question, which is very difficult empirically, meaning seeing and measuring. So I think it makes sense. I don't like it, but it makes, I mean, it makes sense to me what you said.
Yeah, absolutely. Cool. Should we go into the next question?
Sure, it's a doozy. I'm ready for it.
Yeah. Okay. So this is one I picked out for you. So a parent asks, what are some steps parents can take to move through ableism and grief to get to acceptance and love?
Okay. This is a doozy of a question. We could also spend the entire
Yeah,
afternoon talking about this, and I'm going to need your help. That's
sure.
fine.
I will try.
So I'm going to take a stab at this. So one of the things I like to do in general, but also with parents, is to break things down and define them and parse them if necessary. So I have never worked with a family, no matter how, quote, neurodiversity affirming they were, and many of my clients are autistic themselves or PDA autistic themselves. So, you know, I've never worked with a family that didn't have grief in the
Right.
acceptance process, but we can
Right.
often conflate that with being there's something wrong with us and we're
Right.
so ableist, right? And then there's a lot of self-loathing in that. So the first thing I want to do is recognize and maybe define together like what ableism actually is. And I can tell you my perspective. So my perspective is it's looking at another human who does not have the physical, intellectual capability of another human. And because of that, we're putting that person below in their worth, their stature, their value, and like how they fit in to society as a worthy entity, right? So for like my sister-in-law is in a wheelchair. She was paralyzed from the waist down. And so we talk a lot about like ableism from her perspective with a physical disability, right?
Hmm.
And then we talk about the difference between the ableism of a child who you can't see from the outside, the disability, right? And so her perspective is that like she actually wouldn't feel disabled even with a physical disability if the world was accommodating her, right?
Right.
And so I think for parents of PDAers, one of the main sources of ableism comes from fear, which is the fear that our children, or the belief potentially that's been conditioned into us, that our children are not worth just being another human unless they can contribute and not need to be cared for, right? Which is a
Hmm.
very, I think this comes out a lot where it's like, my child might not go to college, or, how are they going to grow up and be independent? And these are certainly things that came up for me of like, how can I re-examine what makes a human valuable and worthy, regardless of their contribution to like, quote, productivity or a capitalist environment,
Totally.
right?
Yeah.
And so,
Yeah.
and I have this deeply ingrained in me where it's like really hard for me to just be, and it's really hard for me to feel like I can rest, right? Because I'm not,
Hmm.
quote, being productive. And like, I think my ableism would come up with my son of like, well, what if I have to take care of him or someone has to take care of him the rest of his life and he can't get a job and contribute and he will be dependent and need to be cared for? But through the lens of disability, how I see other disabilities, I'm like, well, like if someone's in a wheelchair, we need to adjust where we have like, we have to have a ramp. We need to make sure that like we have the pots and pans at a level that's easy to get to. We need to make sure that there's enough room to move through the kitchen. And it's not
Hmm.
stuff you're necessarily thinking about. But I think in some ways, because I can physically see it, and PDA is a fluctuating disability, and we can often assume our children and teens can do more than they can in a given moment, it's like we toggle between like ableism and acceptance, right?
Right. Right.
So that is how I view ableism intersecting with PDA, but I think that's very different than what I think is the continual grief and acceptance process that requires trade-offs and costs directly to the parent
Hmm.
because the parent is the primary accommodation for
Right.
the child. And I want to talk about that, but I want to pause because I want to hear what you think of ableism. Like, how would you define it? And like, do you view it differently than what I stated?
No, I really agree with what you said. I mean, I think, yeah, I would, define ableism in sort of in a similar way we might define other isms, right? Is in the sense it's sort of a prejudice against a specific group of people. In this case, people with various types of disabilities, right? And there's sort of like, I think we get this ableism can kind of play out in the sort of medical model of disability that you were alluding to versus a social model of disability, where in a medical model, it's like, okay, this disabled person needs to be fixed and changed, and they are deficient in some way, right? Whereas, social model of disability is really more focusing on like broader systemic changes that need to happen to support people with disabilities. So, yeah, I mean, I definitely agree with it. I really like what you said around how, and I've seen this a lot in my practice and maybe more so in recent years, where, parents are really hard on themselves, right? Because they might be having feelings of grief or feelings of, frustration and feelings of fear about their child and their child's needs. And they think, oh, but I'm supposed to be neuroaffirming and I'm not supposed to have these feelings. So I really think that, parents need to be met where they're at and with a lot of compassion, because the ableism is the problem that is a broader kind of systemic thing, more so than this individual parent, because we are all born into an ableist society. I mean, this is sort of ingrained, right? And that we also have parents who are not adequately supported, whether that's through family leave, and there's now a parent mental health crisis that the Surgeon General is talking about. And with a parent of a PDA, there's going to be all kinds of ways that often parents are feeling invalidated and not understood by other providers. And so I really strongly believe we have to meet everybody with a lot of empathy and understanding, and then yes, room to sort of deconstruct some of these feelings over time. And certainly, I think it can be important to be looking at, like, as you alluded to, a lot of the parents themselves that I work with are also neurodivergent. And of course, not all of them, but thinking like, well, how was their neurodivergence understood and treated? And how did that get kind of internalized over time, right? Like, how were they parented? Views of parenting have certainly changed. And absolutely, with a PDA informed parenting approach, it's quite radically different, right, from a lot of the way that a lot of parents were parented. So, that's really important, right? I'm also thinking like, what's the sort of trauma history, for parents and how they've experienced it. And all of this can really intersect with this feeling of, how do I sort of get to this place of acceptance and love when I'm just struggling? I'm not getting enough support. I
Not
don't feel
sleeping.
adequately understood.
Everyone
Yeah,
thinks I'm crazy. I'm not sleeping. People are telling me it's my fault. I can't get the kids to school, so I might have to quit my job. Like, I mean,
yeah,
that you're
yeah,
allowed to have grief about that. I don't think that's ableist at
totally.
all.
Yeah,
Like,
of course.
and in fact, okay, so steps, because this parent asked for steps.
Yeah.
Recognize what's ableist and what's not, and stop beating yourself up about it, okay? So, like, the way I try and interrogate my own ableism is exploring what would it look like if my son never earned a dollar? What would it look
Hmm.
like if he needed to live with me for the rest of my life? What would it look like if I needed to deliver him food indefinitely or pay someone to do that? That is a difficult process. But
Yeah.
that's different than the continual grief that I feel when I have to confront these harrowing cost benefit decisions of like, I have to split my family for 3 years because it's not physically safe for my 2 through 5 year old to be in the same home as my PDA son. I don't blame him for the
Hmm.
behavior. And I accept that that's part of it. And then I make a decision to protect my son by separating them. But like, there's a lot of grief about that because I'm not hanging out with my husband for Christmas, right? Or on
Right.
holidays or on
Right.
weekends. And so, like, there will be that continued grief. And I think
Yeah.
that the acceptance piece comes from recognizing, like, the true nature of what this is, which is like you're always accommodating or activating your child and no matter what you choose, there's going to be a trade-off because often we're
Right.
choosing two shitty options, right? Like the kid
Right.
is refusing to go to school, and anytime you're making them go, pushing them, they're having enormous big meltdowns and maybe hitting another kid at school. But
Hmm.
if you quote accommodate them and bring them home and give them
Hmm.
autonomy in an unschooling environment, then the parent has to quit their job and there's a financial cost and an identity and sanity cost usually to the mother. And
Yeah.
that's grievy, right? And I think in
Right.
fact, the parents' grief is an output of neurodiversity affirming parenting practices because there's a direct trade-off on the
Right.
parent.
Yeah.
And I don't think that's ableist to be sad about it.
Of course. Right. We have to like right sort of judging yourself for having feelings like doesn't really get help us work through the feelings. I do think there has to be some acceptance of whatever comes up for sure. Yeah.
Yeah. So separating that, like ableism from making trade-offs that are neurodiversity affirming, but do have a direct impact and trade-off on the parent and family.
Hmm.
And then, as you said, Alex, the like recognizing and welcoming the grief.
Yeah.
Like I do a lot of like Buddhist meditation stuff of like welcome grief. The
Right.
let's sit down to tea and have like welcoming the feeling
Right. Right.
and not
Right.
who you are. But that took a lot of spiritual work.
Sure.
And then not holding on to it as who you are either, right?
Hmm.
Because I think we can get stuck in that anger, resentment, and grief that we're allowed to feel. But like I was stuck there for a couple years, like just
Hmm.
hating everyone and everything and my life.
Yeah. Yeah,
I
I
don't know, do you
bet.
see parents go through that, like get stuck in the anger and resentment?
Absolutely, right? Absolutely. And I think that, typically if we're taking sort of a long-term view, right, like those are periods of one's life as a parent, right? And they go through a journey. And I have found that, sometimes the more parents are listening to and seeking out other parents who've been through something similar or talking to, let's say, a PDA adults and their experiences, through life sometimes that can be really helpful to sort of like, and again, everybody's experience is a little bit different, but I think that sort of helps people sort of lean into thinking about the future in a way that doesn't feel so scary. We just have to avoid thinking about, that's tough. And sometimes even, I recommend, parents thinking about like, well, what options are out there, for post when my child becomes an adult after they turn 18, and to really like dig into that, really look at that, right? And oftentimes we won't know what your kid will need, in adulthood or not, right? Like there's not a ceiling on development. There's variability in what people need, but yes, some people might need more services and care, because as a parent, you can't, take care of your kid forever, of course, right? There's that whole mortality thing.
Yeah,
So I think that
mortality.
like leaning into this, and I think one of the questions that I've heard asked is like, how can we as parents kind of support our children now so that they can sort of move towards goals that they want to move towards when they are an adult, and it can be an important question to start thinking about. But it's a great question from this parent sort of moving through this to get through a place of acceptance and love. I mean, I know that it's a lifelong journey in some cases, right? Or it can be a long process in many cases, for sure.
Yeah. I call it like peeling back layers of an onion because
Hmm.
let me give you an example. Like just last week, my husband and I were walking rare that we were both like out walking with the dog and our kids were back with the au pair and we were just walking around the block and we walked by this woman out in her front yard raking her leaves and she had like a baby in a stroller on her front lawn. And then she had three young children, probably under the age of 6. All of them were helping her. As we were walking by, she's like, "Okay, kids, get out of the way, please." And they were all like, "Okay, mommy," and got out of the way. And she was their mom by herself getting yard work done with 4 children who listened to her. And like, even though I talk about this every day and support parents through this, the whole rest of the walk, I was like, I went back into the grief thing. I was like, we never had that. We'll never have that. We don't even have, like, neighbors think we're, not taking care of our yard because we can't even get outside to rake the leaves. And my husband, Jake, was again reminding me of the same thing I remind him, which is like, we're raising a child with a disability. Like
Right.
it's different, right? But I
Mhm.
still have those moments where I feel envy and I feel resentment of my experience. And
Mhm.
so it doesn't have, that's not where I live, but like it
Right.
still happens.
Right. And I think not living there is also letting yourself feel that, right? And not trying to, being super hard on yourself or not trying to push that away, right? I think part of moving through it is letting yourself feel it too. So, yeah,
Yeah.
but those feelings are going to come up. And I think, yeah, we want to strive towards, strive towards self-compassion rather than self-judgment, right?
Yeah. It's hard though. It's
I
hard.
know. Easier said than done, for sure.
Totally. I mean, I remember, can I just tell a little anecdote? Like
Yeah, please do.
when I first started posting on Instagram, like before I even started a business, like
Mhm.
I would talk about some of the feelings of like the parents. Like that's always been the perspective I was posting from and still is, because I think parents are the catalyst for the change in their families and for their children. But I think I said something about grief once, and like I wasn't used to the social media sphere of trolling and all that stuff. But I just
Mm.
got like harangued, I think is the word, because it's like you're grieving a living child and like, you're not neurodiversity affirming and all this stuff. And it took me a long time to process like, what am I grieving? And is it the child or is it the trade-offs? And like, I think there was a seed of truth in the beginning that like, I wish my child would just do what I would say. That would be much
Right.
easier. I wish he would hug me and tell me his innermost thoughts and
Right.
him so
Of
much,
course.
but like,
Mhm.
okay, that's my ableist stuff. But more over time, it became the grief around not him. Like, I eventually fully accepted him. It became grief about the life that I thought I was going to live and
Right.
the trade-offs I had to make for that
Right.
to work for.
Right. Yeah. And that intersects with the trade-offs you have to make also sort of happen in the context of a lack of adequate support for
Correct.
families.
Thank you.
Right. And so this is where, I think that sort of this is why I just cannot bring myself to, lean into parents or criticize parents sort of feeling this type of grief. Because again, like parents are not supported of it enough. Providers don't understand their kids largely, especially, in the PDA sphere in particular. And, in that context, like, of course there's, feelings around the trade-offs you have to make. And again, it's like the ableism in society that we're born into that I see as the problem there. So we want to, yeah, be careful about sort of locating blame in a parent or in one person, right? Like this is a broader systemic problem. That's how I see it.
I love that. I love that. Yeah, because in theory, the trade-offs don't have to be as high as they are. If
Yeah,
there were more schools designed to support
exactly.
uh,
Exactly.
there were more providers that understood, like you do, how the brain, body, and nervous system of a PDA works. If there was more awareness, I think there would be less judgment and more support from
Hmm.
community. And then
Yeah.
in the medical system, like and training therapists who could potentially be covered by insurance in
Yeah.
if all of those things were in place, I think the trade-offs would not be nearly as high for families.
Yeah.
So I'm so glad you
Yeah.
mentioned. Thank you.
Yeah. I agree. Sure.
You're a genius.
I don't know about that, but we are working on these, thinking about these issues together, and they are tough. This is tough stuff
Tough
for sure.
stuff. Yeah. Okay. So we're building on this question about ableism and grief, and I think the next logical step is this question we receive, which is how do we get past feeling depressed that our life with our son is not normal?
Yeah, I mean, I really think this is an important question because, I mean, first of all, going back to something I said earlier with the Surgeon General coming out with a warning about mental health in parents, and even to the point of recommending that pediatricians, this is not even the parents' doctor, but the parents, their child's doctor, be screening for parental depression. Pediatricians don't have time for that, or they're often not allowed enough time for that. So that's another issue about how do we adequately support and screen for depression. But again, like this is a huge and important issue, right? So just to say another word about depression, having worked at a Kaiser Oakland Medical Center for many years, like I also like to sort of, a lot of the parents I work with, I'm like, even if it's not likely that this is a factor, we always want to actually talk to your physician around like, are you, have you had your workup, right? Like, is there something, whether it's a hormonal thing or whatever, right? Like where, we've just sort of ruled out that there's any other factors that can be contributing to depression. And even if that's unlikely, even if maybe it's that, and there's going to be a lot of other stuff to address having to do with this parent's question, that's one thing that I like to make sure that people think about. Because I think I'm a psychologist, I don't have like a medical training, but we want to know when to bring in other providers, right? So that can be an important piece. This question is, right, so like, how to get past this feeling of depression. And, I think it intersects with a lot of what we just talked about, right? I mean, again, this can be easier said than done, but I typically see kind of hard phases as being phases. And I think when you're really in it, it is definitely hard to imagine it being better in the future, right? Because like that's the nature of depression. We are not feeling hopeful, right? We're feeling hopeless in depression. It's sort of a central feature of depression. So, of course, when we're in that, I think having a little bit of that perspective can be useful sometimes, right? Around like, this is a period of life. This is a really hard period of life. I am absolutely having a hard time with it. That's okay. I'm going to accept these feelings. I'm going to try to get support wherever I can. But again, this is likely just going to be a place that I don't stay in forever. I'm not going to feel this bad forever. I'm feeling this bad now. I do think that if I was to think about sort of some of the characteristics of parents I've worked with over the years who have, been in a really bad place and come out of it, I have noticed that like the way that parents connect to their community and sort of have, try to develop some friendships whenever feasible with other parents who might be dealing with something similar, like also have a PDA kid or sort of really get it. That has been actually a huge buffer because, again, sort of having people that understand what you're going through is huge, right? And I think we see that, through social media, which is great, but also, even on a local level, can people sort of like have each other's backs in a way. I think I've seen some families sort of like develop little mini, local communities of sorts where they're like covering for each other in various ways. When I think parents having sort of like an action plan when things feel really bad, like maybe there is another family member that can give some support, probably not a lot, right? A lot of support, but maybe they can give some, like, parents sort of having a plan for what are the times where I'm really at my worst and I really need, this thing, and then trying to identify like what that thing is to get a little bit more support. But a lot of this question around sort of getting, past this feeling of depression, that we have, and, the way that, this parent's son's challenges are impacting this parent, I think it intersects with what we were just saying before, right? Around sort of, trying to be self-reflective around, our ideas about what kids should be able to do, what my life should be like, letting some of that grief get processed, letting some of that deconstruction of capitalism and how that leads to sort of problematic views of disability. Like all these things can help and can be researched, but those are some initial things that come to mind. I just feel like we have a parent who's depressed, and yes, it can be about, the child, and that can be really, really challenging because parents aren't adequately supported. But also, people come to this with their own histories, like I was getting at before, of how they were parented, their own trauma history. How has neurodivergence been accepted or not accepted in themselves over the years? all of these things I think are important to, to be exploring, so when there's, if it's accessible and available to have therapy, of course, it can be helpful. And then some parents are working on this, they're on their own as well.
Yeah. So when I was digging into the research about like disability in general and caregivers, like the literature on caregivers, the two main things that came up for how parents have better outcomes for mental health, one was community, as you mentioned, which is really hard to find with
Mhm.
PA because so many people are homebound.
Yeah. Yeah.
A, B, it's not like even if another family has a child with it, they might not know because it's not a
Yeah. It's
language.
not the same. Right.
C, it's really hard to get together because it's like you need that the parent needs to be providing signals of nervous system safety and undivided attention. And if you bring the kid and there are two PDAers who
Yeah.
might be
It's
going
not
at
going to work.
so
Yeah.
it is extraordinarily difficult. I think even if you
Hmm.
do it virtually or like via text, like my first community of parents was just like a text thread. We didn't even meet each other for a year. Granted, it was
Mm.
the pandemic, but like
Right.
a lot of us lived very close to each other, and that was like
Right.
how we interacted. The second thing was acceptance in the
Right.
literature, which I think does tie into what we've been talking about. So I think I would say, like, the first step, unless it's like hardwired clinical depression where you need a medication and like,
Right.
no shame, I'm on anti-anxiety medication just since,
Yeah. I strongly agree. No shame. Yeah.
but like, well, two things. One, the hard truth is that like you are raising a child with a disability, and so your life won't be typical. It will be
Right.
atypical from
Right.
like to a degree, right?
Yeah.
And like this is why I'm so adamant about the fact that PDA is a nervous system disability and not just, it's not a behavioral disorder. It's not, I don't want to say just anxiety because personally I've been quite disabled by my anxiety at different points in my life, but
Sure.
it
Yeah.
is a disability. And so, like, with acceptance of that comes grief, and then trying to construct a life that's more joyful within that constraint, right? But if we don't accept the constraint, which
Right.
I didn't for a while, then
Right.
we're going in loops, right? And it can feel
Yeah.
inescapable. And so, I think one of the thought exercises that I went through was like, well, I look around in the community or in different parts of my life when I've lived different locations or countries, like there have been people who were raising children with pretty severe disabilities and like how did they cope and what did they do and did they find ways to have joy, right? And then I went through the process of like, well, why me? But like, why not me? Why not me?
Hmm.
Right? This is
Hmm.
part of the human experience. And so really starting to look outside of, the ODD behavioral stuff and towards like what we consider to be like sanctioned disabilities in the literature and like
Hmm.
raising those disabilities, we can see a different model for like, okay, like and like I know this is going to be triggering to some people listening, and I think that the paradox with PDA is that often when we move through this actual deep acceptance is their neuroception of safety, what they're perceiving subconsciously with us is actually is higher because we're not trying to control the outcomes of who they are and we're not putting ourselves in
Right.
and we're signaling like you are autonomously able to be disabled, right?
Right.
And so it's like this deep, deep level of safety. And then we see the relationship between the parent and child change. And then we see the energy in the home change.
Right.
And then like I see this pattern over and over and over, like when parents move through the acceptance into the grief, but like what can feel like giving up is actually letting go and surrender. And then things really start to change for their
Yeah.
family because the kid feels
Yeah.
and
I
their
love that.
comes down. And then it's like they can surprise you. I mean, my son is doing things I never imagined he would do because I went through the whole process of being like, well, what if I have to deliver food to him the rest of his life? Am I willing to do?
Right. Right.
Other women and men throughout history have had to care for others. And like, I find meaning in that. And can I accept and love the person who I am responsible for, And that
Yeah.
But with PDA, there's like almost like this paradoxical shift that happens when parents move through that because it's the neuroception of safety around, I'm not trying to control you. You're okay who you are as you are.
Yeah. And I think with PDA, like, so like if somebody, I've said this in other talks, and maybe even, other podcasts that we've talked, where we talked about how, PDA can be quite hidden to people, right? Like not
Yeah.
every, so there's like a physical disability, which is more visible, right? And so in some ways, yes, there might, of course, can still be a real process of acceptance and grief, all the things we're talking about. In some ways, it can be even harder with this idea of like having to bring him food, for his whole life, right? Like if it was a physical disability that meant he couldn't get his food, like that is easy to easier maybe for
Yeah.
many to wrap our minds around that, right? Whereas like with a PDAer and you have, clinicians, doctors, whoever just saying like, well, you're just enabling your child or, again, then it becomes harder to get to a place of acceptance. Then, there's more self-doubt. And so part of this is also like the way we just need to do better as a society in understanding these challenges and what the right level of demands and challenges are so there can be a more consistent message around like how do we want to handle it when these types of challenges are happening.
Yeah. And it is hard to wrap your mind around because that same kid I had to deliver food to, once he was out of burnout, like he could go on the trampoline. You know what I
Mm-hmm.
mean? So it's like his
Right.
life's work for the trampoline, but like
Mm-hmm.
it's it can really mess with your mind, right? Of like,
Yeah.
and
Yeah.
like there is that edge of like, oh well, the threat response has come down, so what can they do now? And it's fluctuating. And this is why
Totally.
you're constantly grappling with like, well, how much is it disabling them and at what point? And because it's cumulative, sometimes we assume they can do more than they can and they're at a tipping point. And other
Right.
times, as the years went by, I was so afraid to push anything. Like it was my husband that had to be like, no, no, like you can
Mm-hmm.
try some
Well,
stuff.
that's the role of parents feeling traumatized and again worsened by a climate where there's been inadequate support and understanding of their children's needs. So
Yeah.
yeah, and I think with this example of like the trampoline, right? I mean, I hear this a lot from parents like, well, why can he go to the trampoline, but like he can't go and like get some milk, for their 10-year-old or something, let's say. And part of this is like, well, in addition to the things you just said, is also like maybe he's really interested in the trampoline. We like have a kid. PDA is more likely to have that intraspaced nervous system, right? There's a high overlap with ADHD, where we also talk about intraspaced nervous systems, where like literally our
Can
frontal
you
and
tell
prefrontal
me?
cortex.
Can you
What's that?
define that term? Because I've actually never heard that one.
The way I think about it is like it's much more difficult to use one's prefrontal cortex to, use their executive functioning skills when they're not interested in the topic. So we might hear this in the context of school, the kids would say really interested in like history and reading, but they are not, interested in writing and, whatever other subjects, right? Math, let's say. And so it's
Yeah.
like, and like this is a concept that's true for everybody, right? Like when we're more interested in something, we can maybe engage with it for longer. We could sustain attention of it for longer. We could go to the trampoline, but like not so interested in going to get myself a glass of milk. And so like that takes a little more, you know, executive functioning skills when it's not a motivating, interesting thing.
There's no
And so
dopamine. There's no dopamine with the milk.
right, exactly. And so that I think is also an important concept that is sort of hard for people to understand. Like, well, why can he go go to the trampoline but not get the milk? Like, it's not like he can't leave the couch. He can. Like, well, our brain might be, turned on in a certain way with certain things that is just isn't happening with others. Right. So yeah, that's another element, I think, to it.
Yeah. I always think of it as like he has a threshold for what can be asked of his nervous system, and it's really around autonomy. So like he wants to go on the trampoline. So I'm not going
Mm-hmm.
to I'm not going to have use up a threat around him going on the trampoline, but if I do ask him to get his own milk, it's a drop in the like, we're moving towards the threshold of like how much nervous system activation he can take. So like On occasion, I have asked him to get the milk because it was worth it in that moment. But like as a baseline, I'm usually just getting the milk for him because
Right.
also going to like tackle football and school.
Right.
And I would much rather use it up for him to do that thing that's a special interest in school, which he loves, than like make him get the milk.
Totally. It reminds you of the spoon theory, which you've heard of, I'm
Yeah,
sure. Like
yeah.
this, it's like, oh, I've used all my spoons. I have no more, units of mental energy or executive functioning capacity because I like use it all up at school or use it all up at, my sports, thing or whatever. Right. And then my capacity really goes down. Right. Because maybe, right, if I didn't do all those things for a while, like maybe my capacity goes up a little bit and I will get the milk. Yeah,
Yeah.
so all of this is relevant too, for sure.
Yeah. I think the add on to spoon theory and why I don't use it that much is like I often, and maybe I'm totally wrong about this, but with PDA, it can accumulate over such a long time horizon.
Yeah, totally.
And
Yeah,
often like spoons are talked about in like a day.
right.
Where with a PDA-er, it's like we really need to pan out and be like, okay, what went on the like last 10 days or even 2 months?
Or months. Yeah, totally. The cumulative nervous system activation can take like months to,
Even
you know,
years, right?
right.
But yeah, absolutely. I mean, it's the same concept, right? It's just
Yeah.
the panning out. Yeah, absolutely. PDA is a complex thing.
Oh, yeah. Yeah. Well, you are giving so much useful information. Every time I see one of your videos, I'm learning so much. So I love it. And I love doing these talks and answering these great questions. It's
Yeah,
awesome.
it's so awesome to have your clinical and educational expertise. Well, any last thoughts until our next sesh together?
I don't think so, other than, I think these are great questions. Keep them coming. And we're here to try and support wherever we can.
Yeah, thank you so much, Alex.
Of course. Okay. Take care, Casey. Always good to chat with you.
Thanks everyone for being here with me at the At Peace Parents podcast. This is your source for all things related to understanding, supporting, accommodating, and advocating for your PDA child. To go deeper on any of these topics, check out my course offerings and masterclasses at the website www.atpeaceparents.com. To completely transform the way you think about and relate to your child and to bring peace and stability to your home, join us for the next cohort of the Paradigm Shift program.